Hello once again, and welcome to another lecture discussion for your nutrition and diet therapy subject. And on this video, what you will learn is about nutritional assessment. Okay, so let's get started. Okay, so first of all, what is nutritional assessment? Okay, so nutrition assessment can be done in groups or by individuals, and it is a prerequisite to planning for the prevention or solution of nutrition health problems. Okay, so it's just like your nursing process. You cannot make an intervention without your assessment and your diagnosis. Okay, so nutritional status may be assessed for a population group or an individual. So basically, there are two kinds of nutritional assessment. You have your community level assessment and then your individual assessment. Okay, so community level assessment identifies a population status using broad nutrition and health indicators, whereas your individual assessment provides the baseline for anticipatory guidance and nutrition intervention. Okay, so let's discuss first the community level assessment. Okay, so how exactly is a community level assessment done? Okay, so a target community state of nutritional health can generally be estimated using the vital statistics data, seeking the opinions of target group members and local health experts, and making observation. Okay, so when we say vital statistics data, I am not talking here about your 34, 24, 34. Okay, so I'm not talking about body measurements. I am talking here about the numbers and rates of births, the death rate, the key characteristics of birth, such as the birth by sex, location, and maternal age. Okay, so that is what I mean here with your vital statistics data. Okay, so in large communities, rates of infant mortality, heart disease, and cancer can reveal whether the incidence of these problems is unusually high. Okay, so with infant mortality, it's because the mortality of your infants can actually be caused by your malnutrition. Okay, so although it can also be caused by other problems like birth defects or diseases. Okay, so it's not so sensitive, but still it's an important indicator of a community's health. Okay, also with heart diseases and cancer. Okay, so these are actually can be linked to nutrition because these are lifestyle diseases. Okay, and it can be altered. Okay, with diet therapy. Okay, so information gathered from community level nutrition assessment can be used to develop community wide programs addressing specific problem areas such as childhood obesity or iron deficiency anemia. Okay, so like in the Philippines, what we have here is the vitamin A supplementation program for children around 24 to 59 months of age. Okay, because this is done because there is actually a prevalence of vitamin A deficiency in our country. Okay, so let's now proceed with the next slide. Okay, so anthropometric assessment. Okay, so when we say anthropometric or anthropometry, it came from the word anthropos, which means human, and then metric or metron, which means measure. Okay, so literally it means the measurement of your human body. Okay, so it's basically the physical measurements of the human body that are used for health assessments. Okay, so all providers responsible for taking anthropometric measurements should practice taking correct measurements to avoid errors. Okay, and maintain proper equipment and careful technique. Okay, so the thing about anthropometric assessment is that it can be very helpful. Okay, however, it is also prone to error. So you should always use the proper techniques in doing anthropometric assessment. Okay, so here are the components of your anthropometric assessment. We have the height, and then the weight and the body mass index, and then the body composition, and then your waist circumference. Okay, so let's discuss that one by one. we have the height. Okay, height should be measured using a wall-mounted measuring tape, if possible, or the movable measuring rod. Okay, on a platform clinic scale. Have the person stand as straight as possible without shoes or a hat. Okay, so like the one shown in the picture. Okay, so this is your movable measuring rod. Okay, like that one. Okay, so actually, if you will work as an emergency room nurse, okay, so this immediately you will take the patient's weight and height using this one. Okay, and then we have your children who are younger than 2 years old should measure while they are lying down with a stationary headboard and a movable foot cord. Okay, so this is an example. Okay, that is a cute baby right there. Okay, so this is your stationary headboard and a movable foot board. Okay, so it actually this two actually helps to measure the patient's height more accurately. All right, so for your weight and body mass index, one moment. Okay, for accurate results, patients should be weighed at consistent times. Okay, so like you can weigh your patient like every day in the morning, okay, before breakfast, and it will be more consistent if your patient will be wearing the same clothing or like your hospital gown. Okay, and then ask the patient about his or her usual body weight and compare it with the standard body mass index table. Okay, so actually you will be taught how to compute this one, your body mass index, in your laboratory subject. Okay, so do practice on that. That is very helpful. And the body mass index is calculated by using the body weight and the height measurements, and it is helpful assessment tool throughout the life cycle. Okay, so the interpretation for this would be like your if you're underweight, you're overweight, or if you're obese. Okay, so that is a good indicator of the patient's nutrition or the patient's health in general. Okay, so patients who have lost like more than 5% of their body weight in a month, or above or more than 10% of their body weight over any amount of time for unknown reason should be referred to a registered dietitian for thorough evaluation. Okay, so if you can also refer that to your to a doctor, yes, because actually if the weight loss is sudden, okay, sudden, and you cannot pin or the patient cannot pinpoint what the reason is for the weight loss, it should be assessed further. Okay, so if you're the doc if I'm a doctor, I would suspect for like four common diseases. We have like diabetes, or the patient could have a hyperthyroidism, or the patient could be having could be suffering from pulmonary tuberculosis, or worse, the patient could have cancer. Okay, so that should be assessed further. Okay, and recent weight gain should be noted as well. Okay, so understanding the patient's general weight history over time will give a broad view of expected weight. Okay. Okay, so as for your body composition, okay, so this is actually your dietitian's role. Okay, this is not much of a nurse's role, but we need a little of knowledge about this one. Okay, so the dietitian, okay, first of all, your body composition is the ratio of your body fat to lean mass. Okay, so the dietitian may measure various aspects of the body size and composition to determine relative levels of lean tissue compared to fat mass. Okay, so there are several methods for this, like the skin fold thickness measurement. Okay, so this one with the use of your caliper. So this is your caliper actually, and hydrostatic weighing. Okay, so this is how hydrostatic weighing looks like, and bioelectrical impedance analysis. Okay, so your hydrostatic weighing or underwater weighing measures a person's total body density using Archimedes' principle of displacement. Okay, so it's this is a bit technical. Okay, but I just like give you like an overview of how it works. Okay, so the Archimedes principle states that the buoyant force placed on a submerged object is equal to the weight of the fluid displaced by that object. Okay, so using this principle, the hydrostatic body fat testing method is believed to determine the percentage body fat in an individual's body. Okay, so which means, okay, so this is just the bottom line of it all. Okay, so which means that when the body carries more body fat, he will be much lighter underwater and much more buoyant. Okay, and the same is true for those people who have more muscle mass or have more bones or bone density. What will happen is that they will weigh heavier. Okay, they will weigh heavier underwater. Okay, as for your bioelectric impedance, okay, it means a weak electric current flow through the body, and voltage is measured to calculate impedance or resistance. Okay, so it is believed that your muscles has more the more muscular you are, the more body water you have. Okay, so therefore, if a person is more muscular, there is more water in that person and could lead to lower impedance or resistance. Okay, so that's it for your body compositions. Let's now proceed with your waist circumference. Okay, so individuals who store body fat in the abdominal region have significantly more health risks than their counterparts of the same weight who store fat in the hip and the thigh regions. Okay, so that is according to the book. The experts panel national guidelines for the management of overweight and obesity note that for a lowered health risk, waist circumference should be less than 102 for men and less than 88 for women. Okay. Waist circumference assessment and waist to height ratio are important considerations for both overweight and normal weight individuals. Okay, because actually your waist circumference could indicate for chronic diseases like hypertension diseases such as type 2 diabetes, cardiovascular diseases, your cancer, and of course your overall mortality, even if your weight is normal. So like even if your weight is normal, you are thin, or it's just normal, but then your waist circumference is big or above your normal level, then that would put you at a certain health risk. Okay, so let's now proceed with the next individual assessment level assessment component, which is your biochemical data. Okay, that is your biochemical data. Okay, so it is the use of nutrient and enzyme levels, gene characteristics, and other biological markers, which are components of your biochemical assessment of nutritional status. Okay, so which nutrition biomarkers are measured depends on the problems that are suspected and based on other evidences. Okay, so like for instance, if your client is like not urinating anymore, or there's problem with urination, then most likely your physician will order a creatinine test, okay, which is a kidney function test. Okay, so here are some tests that can be done. We have the plasma proteins like serum albumin and prealbumin. Okay, so which actually evaluate for your protein status. Okay, so if the client has observable like if, an observable muscle wasting, okay, so most likely the doctor will order this one, your serum albumin and your prealbumin. And then we have your liver enzymes, okay, which help evaluate liver function. Okay, so okay, so it's important to actually check for your liver enzymes to evaluate liver function, because like in cases like this of diseases like cirrhosis, okay, so cirrhosis is actually a disease in which the healthy liver tissue is replaced with scar tissue. Okay, so what happens there is that the scar tissue blocks the flow of blood through the liver and slows the liver's ability to process nutrients. Okay, so this is why this is an important data for your nutrition assessment. And then we have blood urea nitrogen and serum electrolytes. Okay, so it evaluates renal function. Okay, so if your kidney is not functioning well, chances are you will have like an increased level of potassium. Okay, so that is part of your electrolyte. And then we have urea nitrogen excretion. Okay, so it helps estimate nitrogen balance. Okay, so your body has to have a positive nitrogen balance, which means that you are taking more nitrogen than excreting them. Okay, so if you have a negative nitrogen balance, okay, so that means that you could be malnourished, okay, or your body is breaking down your protein, okay, so chances are you could have the doctor or the nurse could have assessed that you have muscle wasting or muscle atrophy. And then we have the creatinine. Okay, so this is the height index to evaluate protein tissue breakdown. Okay, so that is your creatinine, and it is also part of your kidney function test. Okay, your creatinine. Okay, and then your complete blood count. Okay, so it could help evaluate your anemia. Okay, so like a low hemoglobin count could mean that the patient is anemic. And then we have the fasting glucose. Okay, so it can evaluate for hyperglycemia and hypoglycemia, and it is used to diagnose diabetes mellitus. Okay. Okay, so the medical tests, okay, this one are used for nutrition assessment, are generally reliable for people of any age, but some conditions may interfere with the results and should be considered when regarding laboratory values. Like, for example, test results may be altered by hydration status, the presence of chronic diseases, changes in organ function, time from the last meal, and like certain conditions, okay? Like for instance, I have this patient before who panicked because his creatinine level was a little bit above the normal level. Okay, so the normal level for your creatinine is around zero point 0.7 to 1.2 milligrams per deciliter. Okay, and his result was around 1.3 something or 1. Okay, so it was just slightly above, and he kind of panicked because he knows that a high creatinine level um, would mean that there's something wrong with the kidney, and he was mortified because he knows of people who are undergoing hemodialysis, and he doesn't want that. But upon further assessment, the person is actually very muscular. Okay, so he was also athletic. Okay, so creatinine is actually a byproduct of your muscle use. Okay, so it was just really normal if his creatinine is a little bit above the normal range. Okay, so again, you should be able to um, so, in other words, and what I'm trying to say is that you should be able to correlate your biochemical data with your physical assessment and your patient's health history. Okay. Okay, so we're done with the A and the B. So we're now here in the C. Okay, the clinical and physical assessment. Okay. So, what is a physical or a clinical assessment? Okay, so a clinical or physical assessment involves visual inspection of a person by a trained registered dietitian, nutritionist, or other qualified professional to note measures that may be related to malnutrition. Okay, so um, excessive or inadequate body fat, paleness, bruises, and brittled hair are examples of features that may suggest nutrition related problems. Okay, so if you can observe this, and you know that this requires or this will urge you to explore further or to assess further. Okay, so physical characteristics are non-specific indicators. So when we say non-specific, okay, so it's not so sensitive. It doesn't usually mean that if you are pale, then it means you are malnourished, or if you have like bruises, it means that you have problems with your nutrition. So it's not so specific, but they can support other findings related to nutritional status. Okay, they cannot be used as a sole criterion upon to which to base a decision about the presence or absence of a particular nutrition problem. Again, there has to be like a correlation with the biochemical data and other forms of assessment in order for us to have a clearer picture as to what the patient's problem is. Okay. Okay, so for your clinical or physical assessment, you can use this tool. Okay, so it's called the Subjective Global Assessment or the SGA. So it's a clinical method of assessing nutritional status based on findings in health history and your physical assessment. Okay, so we have first the weight change. Okay, so here are your components of your clinical and physical assessment. We have um, weight change. Okay, so we have to take note of the unintentional weight loss and the time period of loss. So when we say unintentional, okay, so it means that your patient is not trying to diet or not trying to work out just to lose weight. Okay, he's just really losing weight no matter what, no matter how much food he or she consumes. Okay. And then we have dietary intake. You have to take note of the change from normal duration, type of diet consumed, and you have your GI symptoms. Okay, so if it lasts for more than 2 weeks, okay, like symptoms of nausea, vomiting, diarrhea, and your anorexia. And then functional capacity. Okay, so normal or suboptimal, ambulatory, or bedridden. Okay, so you have to take note of that. Is the patient bedridden? Is the patient still able to eat by himself? Okay, is the patient able to cook for himself, able to prepare food for himself? Okay, so that is part of your of the assessment of the functional capacity. And then diseases and its relation to nutritional requirements. Okay, so does the patient have a chronic disease that could affect the nutrition? Okay, like you have your diabetes, okay, that could affect your nutrition. Does the patient have like cancer? Okay, because that could affect the nutrition of the patient, so you have to take note of that. And then we have physical signs and severity of findings. Okay, so does the patient is the patient losing subcutaneous fat? Is there wasting? Is like or is there ankle edema or sacral edema or ascites? Okay, so this could indicate a nutritional problem. So you do take note of that, like the one you see in this picture. Okay, so as you can see, this is a case wherein there is wasting or muscle wasting. So mean to say the body is breaking down the protein, okay, instead of the fats and the carbohydrates. Okay, so that's about it with your clinical or physical assessment. Let's now proceed with the last one. Okay, that is the D of the ABCD. We have um, dietary assessment. Okay, so as for your dietary assessment, we have four tools that you can use to assess for that. We have the 24-hour dietary recalls and records, and then the multiple day food record, the food frequency questionnaire, and your diet history. Okay, so for your 24-hour dietary recalls and records, okay, it is where a trained interviewer asks the respondent to recall in detail all food and drink consumed during the previous 24 hours. Okay, so it could be done from midnight to midnight. Okay, so with records, it is done this way. Okay, you will be given a paper wherein you will record. Okay, you will record what you ate, or each time you eat you will record that one. Okay, like this one. And you will have to of course there is as you can see it's written chronologically. Okay, and you would have to record also your the details of the food and drink and the quantity eaten. Okay, so here are the strengths and limitation of the 24-hour dietary recalls and records. Okay, so for the strength, Of course, it is fast, inexpensive, and easy to administer. Okay, it can provide detailed information about the types of food consumed. There is low respondent burden because it is only done for around 24 hours, or you just have to recall what you ate for the last 24 hours. Okay, it's not dependent on respondents level of education, literacy, or writing skills. Okay, and does not alter respondents usual intake. Okay, this one is for the recall. Okay, because you do not know that you will be interviewed, so there is no chance that you will change your dietary behavior. Okay. As for the limitations, okay, here are your limitations. Okay. 124-hour recall cannot illustrate typical dietary intake. Okay, because there's only one. Okay, so there has to be a series of like a 24-hour recall, and then underreporting and overreporting are common. Okay, so this is just based on your memory. Okay, if it's a recall, so chances are you will not report the foods that you ate that you think that you don't want to write there. Okay, so like for instance, you actually ate like a whole pizza. Okay, so you don't want to report that, then you don't write that one. Okay, so there's the chance that you will be dishonest with what you are going to report. Okay, so depends on respondent's memory, of course. Accuracy is somewhat dependent upon the skill of the interviewer. Okay, so if it's a recall, if the interviewer is not so good or is not able to like dig deeper, then chances are it will not be accurate anymore. And then omissions of sauces, dressings, and beverages can lead to low estimates of energy intake. Okay, because like your mayonnaise, yeah, that's a dressing, right? If that is omitted, then there's a chance that um there will be a low estimate of your energy intake, right? Okay, so the next is your multiple day food record. Okay, so this one. Okay, so the respondent, okay, so this one doesn't need an interviewer. The respondent records at the time of the consumption and the identities and amounts of all foods and beverages consumed for 3 to 7 days. Okay, so this is your sample form. Okay, so you just have to record what you have eaten with this one. So here are the strengths and limitations. Okay, so for the strengths, it does not rely on memory since the participants record intake immediately following consumption. It can provide detailed intake data. Okay, multiple data are more representative of usual intake. Okay, so this is the big difference between your 24-hour recall and the multiple day record because it is more representative. Okay, it's reasonably valid for up to 5 days. Okay, the limitations would be it requires high degree of cooperation. Of course, you have to ask your client to do this for like 5 days, 5 to 7 days, and it could be like a hassle for them, but it needs a lot of convincing power from the one who administers this one. And then client patient must be literate and be able to write. Okay, so those people who doesn't know how to write would find this difficult or will not be able to do this at all. Okay, takes more time to obtain data because it will require 7 days. Analysis is labor intensive. Yeah, you will analyze like a 7 day record. So that is very labor intensive. Although nurses don't really do this. Okay, so this is the dietitian's job. So if it is any consolation to you, okay. Act of recording food intake often alters usual intake. Okay, so you know that you're going to record, so you will change your dietary behavior. Okay, so you actually want to eat like, if for instance you want to eat like a burger. Okay, but then you remember that you have to record what you have eaten. So instead of eating a burger, you will eat a salad. Okay, so you are being sneaky there. Yeah. Underreporting and inaccuracy estimating portion sizes are common. Okay. Respondent burden can result in low response rates. Okay. So you don't want to do this because it's a hassle. Yeah. So I don't want to do this. Okay. So Okay, so for your diet history, okay, so it with this one, a trained nutrition professional interviews the patient about the number of meals eaten per day, okay, his or her appetite and food dislikes, the presence or absence of gastrointestinal distress, the use of dietary supplements, and lifestyle choices. Okay, so diet histories have been used actually for decades and represent a quantitative method of dietary assessment. Okay, so they require an interview by a trained professional that is 1.5 hours long. Okay, and results must be coded, checked, and processed. Although this is expensive, diet histories provide more complete and accurate data than most other dietary assessment methods. Okay, so try to remember what one. Your diet history is the most accurate. Okay, and complete. Okay, so let's now see what are the strengths and the weaknesses. Okay, so I mean strengths and limitations. Okay, so the strength for this one would be is that it assesses usual nutrient intake, it can detect seasonal changes, okay, and then data about all nutrients can be obtained. It can correlate well with biochemical measures, okay. So as for the limitations, okay, the lengthy interview process, okay, it requires highly trained interviewers. Okay, so it cannot be self-administered. There has to be like an interviewer who will facilitate this one. May over estimate nutrient intake. Okay, it requires the cooperation of a respondent with the ability to recall his or her usual diet. Okay, so again, like with this one, cooperation is the key so that the diet history can be successful or and accurate. Difficult and expensive to code for group analysis. Okay, it's difficult because there's going to be a lot of data that you have to take into consideration. Okay, if you are going to do a group analysis. Okay, and lastly, we have the food frequency questionnaire. Okay, okay, so the respondent indicates how many times a day, week, month, or year that he or she usually consumes specific foods by using questionnaire consisting of hundreds of foods or groups. So okay, so this is how it looks. Okay, so as you can see, um, the food is listed here, and you are going to um, write or put a check as to how many times or how often would you eat a particular food. Like for instance, if beef burgers, okay, so if you eat this 6 times a day, six plus times a day, you are going to put a check right there, or you put a tick right there. Okay, as for the strengths and okay, so as for the strengths and limitations, okay, the strength of this one would be it can be self-administered. Okay, so there's no more we wouldn't need a trained interviewer. It's machine readable, relatively expensive. Okay, maybe more representative of usual intake over periods of time than a few days of a diet records. Does not alter your respondent's usual intake. Okay, so it already happened. Okay, so you don't actually have the chance to like change your dietary behavior. Okay, because it all happened in the past. Okay, so you just have to fill up that questionnaire. And then for the limitation, it requires modest demand on the respondent. Okay, so may not represent usual food or portion. Sizes typically chosen by respondent. Cultural, ethnic specific foods are often not included. Okay, intake data can be compromised when multiple foods are grouped within a single listing. Requires some literacy and a good long-term memory. Okay, so if your patient has a problem with the memory, then it cannot be administered to him or to her. Not effective for monitoring short-term dietary changes. Okay, so this one is for your long-term. Okay, so I would just like to add also that these tools or dietary tools can also be used. Okay, so it can also be used with your community level assessment if you're going to make a study. Okay, you're so that's it. Okay, so I guess that ends my discussion about this concept. So I just like to leave you with this quote, which says, from one must eat to live. Okay, one must eat to live, not live to eat. Okay, so this is just a friendly reminder from your nutrition teacher right here. Okay, so and also if you want to read my resources, your book resources, I have it listed here, so you can check it out. And I guess that's it. Thank you so much for listening. See you next time. Bye bye.